This is Crystal Fenn with MedPage Today here in Gothenburg, Sweden at the Heart Failure Congress, where researchers have reported that the use of the diuretic eplerenone appears to reduce atrial fibrillation and flutter incidence in heart failure. I spoke with Dr. Carl Swedberg of the University of Gothenburg, who presented the results here.
In these patients with mild systolic heart failure, we had pre-specified that we wanted to look into the development of atrial fibrillation, which is of concern in patients with heart failure. The intervention in this trial was a double-blind placebo compared to eplerenone. And what we found was that in the eplerenone group, there were significantly fewer patients who developed atrial fibrillation. That was the main and important finding. It was a 41% reduction in the incidence of new onset atrial fibrillation. In addition, we could demonstrate that the effect of the beneficial effects of eplerenone was not dependent on the on atrial fibrillation or not. So it worked in both groups, which was important to know as well.
Swedberg suggested this was an additive benefit rather than a reason to initiate eplerenone for heart failure patients.
I'm certain that this in some way will be discussed in guidelines. Now, this study isn't strong enough to make it a strong recommendation, I think, but it adds to other beneficial effects. I mean, you don't use this because you want to prevent atrial fibrillation. You use this intervention because you want to prevent death and morbidity. And now you have added benefits, so there is even stronger reason.
So eplerenone appears to offer an added benefit in heart failure by reducing the risk of atrial fibrillation and flutter. In Gothenburg at the Heart Failure Congress, I'm Crystal Fenn, MedPage Today.